Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
My mic sounds nice, check 1. My mic sounds nice, check 2. My mic sounds nice, check 3. What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 275 of the Ask Dr. Angela podcast. It's just me, your girl, with my usual shenanigans. Podcasting is so fun for me. I absolutely love it. I'm gearing up for another long week. My weeks are always long because I pack a lot into a little. Between call, between crazy office hours, between lots of cases in the OR, being a mom, wife. I just am doing what I do. But I absolutely love what I do. And, this is just another avenue of expression for me to keep it fun, light, and of course, keep it real and keeping you in the know. So that's, the primary reason that I do this. It's just so much fun. Actually, yesterday, we met some friends for dinner, actually a movie, and then an early dinner. We went to see Mamma Mia, and if I'm going to be completely honest with you, I hadn't seen Mamma Mia 1 before we saw Mamma Mia 2, and I don't know that I'm really a fan of when they make movies that are like musicals. You're watching and then all of a sudden people are bursting out into song. It's a little bit distracting for me. But needless to say, I don't know that I particularly enjoyed the movie. Cher was great. Meryl Streep, was in there for like a few. But it was hard for me to determine where we were, like present, past. There was like a lot of back and forth. And, we subsequently came home later on that evening and watched the first Mamma Mia, and it completely put me to sleep. But my mini enjoyed it, so I guess that's all that matters. So we went to Red Bank yesterday for dinner, and all of a sudden I'm walking down the street, and all of a sudden I hear this, "Hello, doctor." And it's my really good friend, Ming Chin from over at A Shared Universe. They're amazing. They helped me set up my podcast studio in my home. They were able to fix the quality sound-wise of my podcast, and I'm like ever so grateful for that. But I love when I see people out and about in public that recognize me because I'm usually kind of goofy, always have some shenanigans, or I'm like laughing and it's like completely loud. My little one always says to me, "Mommy, use your inside voice." But I'm like, that is my inside voice. Your mommy's just really loud. So today's topic is really, it's interesting. It's on vaginal seeding. It sounds like you're planting a garden in your vagina, right? But that's not exactly what we're talking about here. Have any of you practiced this, vaginal seeding? Do you even know what it is? I got to tell you, I recently saw a patient in consultation. We work with a group of midwives, and oftentimes we'll see their patients in consultation if they're at an increased risk for a C-section or if they might need a C-section. And so she said to me, "Dr. Angela, we want to vaginal seed, so will you do vaginal seeding at the time of the C-section?" And of course I was like, let me just quote some literature for you. As open as I am, I'm also pretty conservative in my practice. And what I mean by that is, I am open to many different things, but I'm also very black and white when it comes to some things. I know that ACOG, which is the American College of OBGYN, can be very aloof with regards to their guidelines sometimes. They're very clear about their stand on vaginal seeding. And for those of you that don't know what the hell I'm talking about, and again, you think that I'm talking about, growing plants, flowers, vegetables in your vaginas. That's not what I'm talking about. Basically, what vaginal seeding is when you take like a cotton swab, a lap, or whatever you have, gauze, and you use it to transfer vaginal fluids to the mouth, nose, or skin of a newborn that's been born by C-section. Now, here's the rationale behind that. The reason that people recommend this or they embark upon this is because there's some thought that in women that ended up with a C-section, the baby isn't exposed to, let me put it to you this way. This is the thing. If the thought is that when babies don't pass through the vagina, that their gut isn't colonized with, the types of bacteria that will decrease their risk of getting things like asthma, immune disorders, etc. So, there's this ongoing theory that, with the increased risk of C-section, or the increased rate of C-section, I should say, that we're seeing more children that are developing things like asthma, immune disorders, etc. Now, basically what ACOG says about this is that there is no strong body of data that can conclusively draw a relationship between C-sections and an increase in the things that I just mentioned, i.e. asthma, immune disorders, etc. So as a result of that, they are not recommending the practice of vaginal seeding. The only way that vaginal seeding is being done is in the context of research. Because up until this point, there is not, and there has not been any adequate data that, states that this is a safe practice or that this is a beneficial practice. So I'm just really curious if there are any of you out there that have, undergone vaginal seeding. Did you ask your doctors to do vaginal seeding if you end up with a C-section? I don't do it because the guideline dictates that we don't do it. And I'm kind of a safety kind of gal. I follow the guidelines. That's the kind of physician that I am. But I would really be interested in knowing if there are any of you out there who had this done. I want to know what your thoughts are, etc. It's kind of a hot topic right now. Anyway, I hope that this has sparked your curiosity, and, certainly reach out to me. Hit me up on social media, send me an email. I want to know what you think. As is the usual, thank you so much for tuning into today's podcast. I appreciate you more than you know. I would love, love, love to hear from you, and I do love hearing from you. You all know where to reach me, www.askdrangela.com. That's AskDrangela.com. If you hit me up there, you have access to all of my social media venues. That's Instagram, Facebook, Twitter. You can either email me or direct message me. I will get back to you because I'm that kind of gal. And I'm getting literally messages from all over the world. I can't keep up with them. So just know that if you reach out, we will get back to you. So what I'm going to do is leave you with another instruction from Life's Little Instruction Book. Y'all know this is one of my favorite books and resources to go to. So I'm going to leave you with something from 261. Lesson 261 says, take family vacations whether you can afford them or not. The memories will be priceless. Thank you so much for tuning into today's podcast. Until next time, look better, feel better, be better. I cannot wait to reconnect on episode 276 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.